So today I'm highlighting the possible conditions. There are many more, but the possible condition are the most common conditions that possibly affects a woman in her pregnancy. Feel free to make your suggestions as to the topics that you want or you're not seeing available in this briefing, but you want to know more about. Feel free to make your suggestions. Thank you. What is postpartum hemorrhage? Postpartum hemorrhage is any excessive blood loss of 500 mils or more post-vaginal delivery, or more than 1,000 mils blood loss post-cesarean section, or rather it could be put as any excessive blood loss that can affect the mother in a negative way. Alright? Hyperemesis gravidarum is a severe form of nausea and vomiting in the pregnancy. It is known to be more severe than morning sickness. It appears around the 8th to the 12th week of pregnancy and should resolve itself around the second trimester. However, unfortunately, some women endure this condition for the entire pregnancy. What is bleeding in early pregnancy? This is any bleeding from the genital tract before the 24th week of pregnancy. What is antepartum hemorrhage? This is bleeding from the genital tract after the 24th week of pregnancy. There are some conditions that lead to antepartum hemorrhaging, and this is also known as bleeding in late pregnancy. You have placenta abrupta, which is a premature detachment of the placenta from the uterine wall. There's also placenta previa. Alright, placenta previa is an abnormally located placenta which should be noted in the upper portion of the uterus. It has now found itself in between or to the lower part of the uterus. Alright, so we'll be talking more about this in future posts. We'll be talking about multiple gestation. This is the appearance of more than one fetus in the uterus at any given time. So you can have twins, triplets, quadruplets, quintuplets, septuplets, you name it. Once it is more than one baby in the uterus, it is known as multiple gestation. We'll be talking about diabetes, and this is an abnormally high glucose reading in the blood, and this is due to little or no production of insulin hormone. Anemia is a decrease in the oxygen carrying capacity of the blood due to decreased amount of red blood cells in it. Pyelonephritis is an inflammation of the kidney due to bacterial infection. Urinary tract infection is an inflammation of the urinary bladder due to a bacterial infection. If the client was diagnosed with high blood pressure before pregnancy or before the 20th week of pregnancy, it is known as chronic hypertension. If the client has been diagnosed with high blood pressure after the 20th week of pregnancy, it is known as pregnancy-induced hypertension. Preeclampsia is the manifestation of high blood pressure conditions, protein in the urine, and swelling of the hands, face, limbs, or other parts of the body. Eclampsia is preeclamptic conditions that have now escalated into the mother having seizure conditions. We have a condition known as HELLP syndrome, which is hemolysis, elevated liver enzymes, and low platelets. So preeclamptic conditions have gotten so severe that the mother is now having conditions where red blood cells are being destroyed, possible liver damage, and also low platelet count in the blood. What is jaundice? Jaundice is a yellowing of the skin, the eyes, or the mucous membrane due to an excessive buildup in the blood of bilirubin. This could be caused by inefficiencies in the liver. Polyhydramnios is an abnormally large amount of amniotic fluid around the fetus. Oligohydramnios is an abnormally small amount of amniotic fluid around the fetus. Cephalopelvic disproportion is a condition where the fetal head will not be able to pass through the mother's pelvis. Alright, so this mother will not be able to have vaginal delivery because of a difference in size between the fetal head and the mother's pelvis. Rhesus isoimmunization is majorly caused by rhesus negative clients. So those mothers with A negative, B negative, or AB negative blood types. If fetal blood becomes mixed with the mother's blood, whether in pregnancy, childbirth, or postnatally. This woman can become sensitive. All right, it does not affect the first pregnancy, but it will affect future pregnancies if an immunization of a RhoGAM injection is not given within 72 hours of birth. All right. Rheumatic heart disease is caused by a bacterial infection of the upper respiratory tract, which could cause damage to the heart valves. Even after being confirmed as pregnant, some women continue to do smoking and they continue to do drugs and alcohol. This can affect the baby negatively in terms of development, the size of the baby, and the baby can also become an alcoholic and a drug addict. Alright, so you want to be careful of that. Sickle cell disease. It is very important that couples know their sickle cell status before they decide to have children. If the mother has a sickle cell trait and the father has the sickle cell trait, there's a 1 in 4 chance that they can produce a sickle cell disease child. Now, sickle cell disease is the abnormal shape of the red blood cells. The normal red blood cell is spherical, it is round in shape. The sickle is C-shaped, so it does not flow through the blood vessels as easy as a red blood cell, and this can be very detrimental to the child or the adult. All right. Systemic lupus erythematosus, also known as lupus. This is a reddish butterfly-looking rash across the nose and the cheek, and this is where the immune system attacks its own self, causing severe and widespread damage to tissues in the body. Thrombocytopenia is a decrease in the amount of platelets in the blood, causing clotting to become very difficult. So these patients are at risk for bleeding because the clotting factor that is necessary with the help of platelets is not there because it is too low. Uterine prolapse is a condition where the uterus has left its normal position in the pelvis and has gone down into the vagina. Deep vein thrombosis, or DVT, is a formation of blood clots in the leg. Teenage pregnancy is any pregnancy that occurs between the ages of 13 and 19 years of age. There is strict management for these mothers, and I will be talking about that in future posts.